Hi, I wanted to take some time to talk about um, my experience with Dr. O and the Oat procedure. I know that when I was diagnosed with adhesive capsulitis, also known as frozen shoulder, I was deeply, you know, interested in finding out more about this disorder and problem that I had. And, the research was pretty bleak. They talked about, not knowing the cause and physical therapy and, you know, different types of stretching, and that it can take years to resolve. So naturally, not wanting to take years, I researched the internet, finding out as much information as I can. And like many others who have frozen shoulder, they run across the trigenics. And you may be a little bit scared or skeptical about the treatment, as I was. It's not mainstream medicine. Although I believe there's a lot of scientific evidence to back up the treatment, it's not well known. I'm currently in the United States, and I was told, that I would have to go to Canada for the treatment, or Europe, and I wasn't aware of any, treatment, the Oat procedure, in any other place in the United States. I wasn't sure my insurance would cover it. My physical therapist hadn't heard of it. My chiropractor hadn't heard of it. And so it's scary. But there isn't a lot of well-known treatments for frozen shoulder. And it's a really terrible condition because most people don't know what it is. I've been a nurse for over 30 years, and I never had a patient with frozen shoulder. I never had a friend or relative or experienced it at all. So I didn't know what it was myself. But when you are afflicted with it, it's awful because most people can't relate to it. So your handicap, your inability to reach things and do common things like comb your hair, reach for the seat belt. They can't understand the pain that you're in. Sleep, I wasn't getting any sleep. I was in tremendous night pain. I told my doctor, I know that I have a torn rotator cuff. He says, listen, this is my specialty. I deal with this all the time. You don't. I insisted on an MRI, and he said, no, you don't have a torn rotator cuff. But all the muscles, surrounding my shoulder joint was in pain, and it was night after night after night. And I'm a person that I've invested a lot in my health, and I could see it deteriorating in every area. I could see that the muscle was atrophying. I wasn't able to use the arm, and so there was increased pain. I wasn't getting sleep, and I knew that my resistance was, deteriorating or decreasing, not as strong, and that I would eventually get other problems. And all the research that I did on frozen shoulder was like years. They said the average, person to be cured was 30 months, and they didn't even promise a cure. It was like, there's a great many people who it never resolves, and you never get full range. And I was just devastated. I didn't understand it, and I went full blast. I was paying for a chiropractor weekly. I was going to physical therapy twice a week. I was buying books, going to YouTube videos and implementing all of the exercises and stretches. I did a poultice with comfrey. I did herbs. I did turmeric. I did other pills that were supposed to help MSM and, magnesium. And I did whatever I could to no avail. And I must say that I can't say that nothing worked. or I shouldn't say that, that there wasn't some benefit from those treatments. I know people commonly say, oh, nothing worked. That's not necessarily true. I think the stretching helped. I think the supplements helped. But I was still very limited in my range and very much in discomfort. But now that I'm post Oat procedure, I think that it helped to prepare me for that. I think it helped my speedy recovery and it helped my tolerance and, to the procedure and my success. So let me get to what I really want to share with you. And that is because what I was looking for, I couldn't find in the videos. I saw videos with Dr. O, and I saw videos with those that were working with him. And when you see that, you're a little suspicious because you feel like, well, what if they're being paid to do it? Or maybe it's biased because it's coming from the trigenics, which is, it's a trigenic type of procedure. Maybe there's some bias. So you're a little concerned. And then you want to know the negative side. A lot of times they promote just the positive. And there are other things that you need to know. And I researched and researched and researched, and all I saw was something positive. Well, naturally, I saw all these success stories, and I went ahead and decided to go with the treatment. I felt I had nothing to lose. It was a non-invasive treatment. There's no incision. There was success recorded, so I knew somebody was benefiting, and I was willing to try it. So I did what was necessary, filled out my forms. I spoke to the educational director and made my appointment. Again, I want to repeat that I didn't hear of any negative things related to the procedure. So when I got in the waiting room there, I was a little scared, naturally, because it's unknown. And I knew that there were some medications that I needed to take, and I was nervous because I was into holistic health and very anti-medications and into herbs. And so it was a little uncomfortable, and I had made up my mind that I would take some, but not all. And my daughter, who accompanied there, said, "Mom, just do what they say." So I decided to do that because I knew that they had been doing it for a long time. Dr. O was an expert, and it was, I was going to give him a try. I wasn't going to come in half step. So while I'm sitting in the waiting room, I'm reading these negative reviews. I'm reading about it didn't work for this person or that person. I read about some of the workers there not being very pleasant, and some of their interaction with the personnel was not favorable. And, that it was painful. I wanted to leave at that point. I don't know what, I was a little scared because I hadn't read anything before that was, negative, and I was scared. Somehow, I knew that my options were few, and I was already there in Canada, and I was already in the office, and I already had an appointment. So I gave myself a positive mindset, and I said, I'm going to create a positive atmosphere. I says, it doesn't matter the way the staff may treat me. I may not feel comfortable or that they're kind is the way I would want, but I'm going to create a positive atmosphere. I need them, and I need us to be in a positive atmosphere. So, I interacted with the staff. I think the particular person that I interacted with was very matter of fact. I was jovial and kind. I was considerate, and I didn't make any room for there to be any rift between us. I'm part of the medical system, and I understand that it's important to be respectful and kind and be in good favor. And I took it upon myself to create that environment. And I did. I apologized for any inconvenience, and I was compliant and courteous and kind. I had to take some medications, and when you're listening to some of the videos, they'll say, well, we do it with or without anesthesia. I wouldn't recommend it without anesthesia. I'm not sure why anybody wouldn't want that. They offer lidocaine, they offer a steroid shot, they offer a tranquilizer, and I would do it. I mean, if it wasn't for my daughter who said, go ahead and do it, I probably wouldn't have, but I think that it's uncomfortable enough that you should. All right. If you're not heavy on medications, then more than likely nothing negative is going to happen as a result of an infrequent use of these medications. So I took the shots in my arm. The doctor was great. There was no pain there, Dr. Rosen. And I took the Percocet. I took it on an empty stomach, and I was questioning that, and they said, go ahead and do it. And it did make me queasy, and it did upset my stomach a little bit. It was tolerable, but I would say that it would probably be better to have, some food in your stomach. And I took the medication, and I underwent the treatment. The treatment was painful. It wasn't unbearable pain, but it was painful. I think with the tranquilizer, it made it bearable and fuzzy. I remember being in the best sleep of my life. And then, when they were ready to begin the procedure, they woke me up and began to manipulate my arm, and it was uncomfortable. And I think I told them, stop, it hurts. And we had already agreed in the consent that they would finish it and go forward. And my husband, who was there, said they did this and they did that and they did this and that. And I don't remember all of it. So the tranquilizer really helped. It was painful at periods. Like I said, it was bearable pain. It wasn't anything close to childbirth, but it's certainly of a different kind of pain. And then after the procedure, right away, the pain that I had had for months in my rotator cuff was gone. That was released. And they sent me home with narcotics, Percocet, and they told me to do exercises every hour. I took the Percocet again. It upset my stomach. And I exercised every hour, and it was really painful. And they explain to you very clearly that it's going to hurt, but if you want full range, you've got to do the exercises. And I did. I did the exercises every hour. It was really tough. I really focused on getting to the in range of the exercise as they encourage. I think later on, a few days later, I realized that it was really painful for me to do that, and maybe it wasn't so necessary, so I didn't inflict myself with as much pain and eased up a little bit on that. I had done a lot of research, and I knew a lot about fitness. I was a fitness instructor before, so I thought about the exercise and what is it trying to accomplish, and I improvised once in a while. Or I shouldn't say once in a while. Honestly, I improvised. I don't know that it's the best thing to do. The best thing is probably to do what they said, but I realized that they were working on extension, putting your arm up. And they would have you put your arms together and bring your arms up. And if I was hurting, I would do one arm. Sometimes I would just do the one arm instead of both arms. Sometimes they'd have you go up and down. Sometimes I wouldn't go all the way down because I could go down. That was no rigidity there. It was the going up. So I did, try to improvise a little bit. I used the cable ropes a little bit for some of the movements that they had me to do. I used a foam roller to lay on to do some of the exercises laying down instead of up, standing up against the wall. I did some of them laying on my stomach prone. They have you bring your arms up to the side like this. And I found when I stood, my arms would come forward. So I would lay on the ground and do it. And then my arm couldn't go forward and get out of line because the floor would limit that. So I did improvise, and I want to do a video to show those improvisations. But your best bet is to do what they say, and to go to the farthest you can in the move without tremendous, intolerable pain. Be consistent. And I'm at day 8, and this is my best day in terms of pain. I had pain on probably day 3 and 4. The first day was none. It was like, this is gone, I'm good, And then, day 3 and 4, it started to kick in. I don't know if the inflammation, mostly the exercises is what caused the pain. If I was at rest, I was pretty good. I could lay on my stomach, put my arms above my head when I sleep. But today I don't feel any pain. I'm doing my exercises. So I just wanted to encourage you. Nobody paid me to do this video, as you can see. It's not a professional video. And I'm doing it for 2 reasons. One is that my life has been so enhanced. The quality of my life has been so benefited and improved because of YouTube videos. And I want to contribute to that body of knowledge. I'd like to get the cameras and learn how to perfect my use of it. I know the lighting isn't good, but I want to get the information out there to help someone because I've been helped so greatly. And the other thing is I wanted to tell you the things that I didn't know when I did the Oat procedure. I didn't know, I wasn't sure if it would be painful. I didn't know the exercises afterwards would be painful. I didn't completely understand, the shots and how painless they were. I was really afraid for you to give me a shot of lidocaine or, a steroid, but it was painless. I understood that I was going to be given Percocet, and, it affects people differently. It gave good pain relief. It upset my stomach. I ended up using Motrin, and Motrin gave good pain relief. The problem I found with it is that the relief was so good that at night I would lay on the shoulder and then wake up when the medication wore off in excruciating pain because I was laying on that side. So I used a minimal amount of medication. I used it when I needed it, but it was worth it. The procedure was worth it. It was worth every dime. It gave me a life back. I'm a religious person, a spiritual person, and I believe in God. And I have to give credit to God for using Dr. O. And it really turned my life around. It may even have saved my life. I didn't know how long you could go without sleep, and I had probably gone 6 months without getting sleep, turning and twisting. And I have a lovely husband who rubbed my shoulder every night at any hour. I'd bump him, come rub my shoulder, it hurts. I was in lingering pain. It was beginning to take a toll on my mental health. I didn't want to do anything or go anywhere. And so now I'm trying to make it back up to my husband, and I'm cooking for him, and I'm trying to make the home pleasant for him, and I'm trying to do things to, because for almost a year, I've had an uncomfortable shoulder a painful shoulder, the last 6 months, a frozen shoulder, and it's really limited me. And like I said, it's tough because people don't understand. So that you don't get sympathy. There's no crutches. There's no bandages. It's nothing people can identify with. If I say a sore throat, If I say labor pains, you have an understanding. But when you say I have frozen shoulder, people are like, oh, okay. Now, and they just move on. They don't recognize the pain that you're in, the discomfort. And so it made a difference. Yes, there's pain involved in the procedure. Yes, it's tolerable. Yes, take the medication. Yes, do everything they say. And if there's anything that I can do to help you to move forward in that decision, then, make a comment down in the video, give me your particulars, and I'll call you and we can connect and I can help you in any way I can. It was a great blessing, and I thank God that I was blessed in that way. All right, hopefully, this won't be the last video, but I hope it made a difference. Take care, friends.